To have you all gathered here in the light of World Cancer Day. I'm Anju and this is Zaina. We are your hosts for today and we welcome you all on behalf of our departments, CLMO and CBio.
Welcome to Cancaware 2022, the first awareness raising event that aims to educate ourselves and fight against cancer. This year, we celebrate World Cancer Day with a whole new approach under the slogan Close the Care Gap, which represents the understanding and recognition of equities in cancer care around the globe.
We would also like to appreciate and welcome our special guests and attendees taking the time to be here. We are grateful for your presence. Now, we'd like to call upon Director Dr. Shaji, Dr. Grace Joseph, our Chief Guest Dr. Bharat Shankar, Dr. Amrinder from the Indian Cancer Society NGO, Dr. Shweta, Dr. Atul for the traditional lamp lighting ceremony.
Mahaganapatham Manasa Smarami Mahaganapatham Manasa Smarami Mahaganapatham Manasa Smarami Mahaganapatham Manasa Smarami Vasishtavamadevaदिवन्दित महागणपतिम्. Before we begin, I'd like to invite a very dedicated and honorable person, the director of SEHS, Jain University, Dr. Shaji Thomas, to address the crowd.
A very good afternoon to all of you. I'm seeing a lot of happy faces here today. So what's the reason behind that? It's a celebration. It's a time of celebration. And much more than that, as all of you have determined to create more awareness among the public, to talk about the need of understanding cancer and treating it the way in which it is supposed to be. I think that could be the reason I'm seeing a lot of happy faces around here now. And at the same time, I have the honor to welcome and also receive our guests today. And we are having both Dr. Shankar as well as Dr. Amrinder here. And I have been having a very short and brief discussion with them. I'm so elated when I was sitting with them to understand that the amount of work what they have been doing it and the amount of passion they carry while they are executing their work, which I could gauge it, though we were there only for a few minutes we were there. And I'm glad to see that, people like Dr. Shankar as well as Amrita ma'am is here with us to educate you people, motivate you people, and to understand that, and also to congratulate you people for having taken this particular specialized field of cancer and oncology and related areas. Why? Because as we understand, though I'm not going to present any statistics in front of you people, among all the ailments or the sickness, the maximum number of people in the entire world suffers from cancer in one or the other form. So we need to understand the importance of that one and how to combat that particular so to say disease. We need to be very, very careful. At the same time, creation of awareness is what is being missing it now. And as far as we are concerned, we are all always doing not important work, urgent work we are doing it. Most of the time we are doing that. Now in a country like India, when a large number of population is suffering from cancer, and the doctors and the entire team who is supposed to give the treatment, they will be behind giving that particular treatment and see that okay, how this patient can be saved. But much more is required from you people, youngsters, to see that okay, do an active research, to see that okay, what all best we will be able to do it in the field of cancer research, and see that okay, your services also will be added to the existing fold of the so to say the fraternity of all the people. I should say all the warriors who have been working in this particular field of so to say cancer. When I'm using the word warrior, I'm really proud and I mean that particular thing, because this is such a kind of a menace where we will not be able to deal until and unless you are having that presence of mind and also that sort of a courage to deal with a cancer patient. And you just go to a hospital, say that I had a fracture, the doctor will take it very easily and they say that's it, like that. And even the patient is also not much worried. They know that they are going to come out of this the situation within a couple of weeks time. But that is not the case with a patient who is being identified with the cancer, right? Okay, so a lot of work the entire system, including the doctors and the entire team, has to do to give that confidence to that particular patient also apart from the treatment. But that is where all of your services will be requiring in the future, and having decided to be in this particular specialized field of oncology and cancer, and I should definitely appreciate all of you. And together we have to do a lot of work to see that okay, more and more awareness will be created among the public as far as how we will be able to prevent. Okay, and a lot of things, a lot of work we can do it. As of now, what happened? Majority of the people are involved in identifying curative methods. Okay, even I'm proud to tell you that okay, our phytochemistry department here, they already started and we have filed a patent for cancer on the breast cancer. We already started the work here in a very small way, and so that's the type of initiative some of your seniors have started, but we are somewhere stuck because of the availability of the so to say the input whatever we require. It is not. I should say that okay. The substance what we are based on which we are going to work, we need a lot of legal permission to avail that particular thing. So we are still working on that one, and we started that particular work. So if that can be initiated by some of your seniors, much more you people will be able to do it, because the university and the cancer institute etc will be able to support us our venture like that. Okay, I'm happy to see that okay, both the faculty members and students are all present here, and to be a part of this particular activity today. I don't call it a celebration, rather an activity. And because we have decided to do something good in this particular field today, right? Have you all determined to do that? Is it the mindset today, or it's okay, we will just come and see what's happening here? Is it so? Not, no. Because all those who are seated here, you are coming from that particular specialized field of oncology, right? One or the other way you are related. And I take this opportunity to once again welcome Dr. Shankar. And I was so delighted when I was sitting with him, because Shankar sir comes from Sursa Vaidehi hospital here, and they are one of our nearest neighbor, I should say that. And we hope that we will be able to do a lot of joint activities for the benefit of the society. And for all of your information who are seated here, the anesthesia technology students and CRT students, 36 in number, they'll be undergoing a 3 days workshop in Vaidehi under VASA at the title, and which we are going to start it in the coming week itself. So we already started association, and now Sangasas coming here has, so to say, increased our confidence level to see that okay, we will be able to have more and more joint related activities. And I will not take much of time, because they are the people who have to educate you today, motivate you today with respect to cancer and cancer awareness. And next, Amrita ma'am, we are honored that okay, you are here with us, and your vast experiences and amount of work what you have been doing in this particular field, that should definitely motivate my children today. I take this opportunity to thank you for being present here. Once again, thanking you, all of you, and with best wishes, let me conclude. Thank you all.
Thank you, sir. That was indeed insightful for all of us. Next, I call Mr. Pinak of CLMO 2021 to present us with an overview of cancer.
So today I'm going to give just a brief oversight about cancer and its statistics. So as you all know, what is cancer? So as we all know that it's a disease in which the damaged or abnormal cells of the body start multiplying rapidly and do not differentiate, so they form a tumor. So clinically, there are many types of cancer, but biologically, the origin of cancer is similar, which is due to defect in gene expression, or we also say it as a mutation. There are some factors which are responsible for change of normal cells into cancer cells, and those factors or agents, we call them as carcinogens. So it is believed that all cells carry certain cancer-producing oncogenes. Now, oncogenes, so these are the genes that are responsible for induction of tumors. Under certain conditions, these genes are triggered to multiply rapidly into malignant neoplasm. So here you can see a post to 2020, like all of the cancers and its statistics all over the world. So how it is spread according to the geographical areas. So you can see number of deaths in 2020. In lung cancer, it was the highest, and number of incidents, the breast cancer selectively was the highest. So these are the most common cancer in the world. As you can see across the globe, the most common cancer is breast cancer, followed by cervix and then liver. And in China, you can see based on geographical locations, in China, the most common cancer is lung cancer, followed by thyroid. So these are the most common cancers of India. As you can see, it's been differentiated into men and women. So in men, you can see as lung cancer, stomach cancer, prostate cancer, esophageal, and brain cancer. These accumulate almost half of the incidence of in men. And in women, it's basically breast cancer and cervix cancer. As you can see, the reported cancer incidence in India in 2022 is estimated to be 19 to 20 lakh, whereas this number 19 to 20 lakh, it's just reported incidence. As we all know, a country like India, many people are uneducated, and there's a myth about cancer that, like suppose we have a lump or something, we'll just say that fine, it's nothing, like we can go on. So if you say that, the real incidence can be likely higher, like more than 1.5 to 3 times than this rate. So according to 2020 WHO ranking on cancer burden, India has been ranked at third position after China and the US. So 6 states in India, which represent 18% of the India's population, have 23% share of the country's reported incidence burden and have the highest crude incidence rate. The 6 states are namely Kerala, Mizoram, Tamil Nadu, Karnataka, Punjab, and Assam. These states have reported the highest overall crude incidence rates of cancer, which is greater than 130 cases per lakh population. This report mentioned. These are the most common cancer in India. The most common cancer in India, and to be honest, over the globe, is breast cancer. So second, you'll get oral cancer. Again, in oral cancer, you can subcategorize into 2 parts. One is the buccal cancer, and one is the tongue cancer. So in the Western countries, tongue cancer is common, and in countries like India, buccal cancer is common. I mean, see, in country like India, almost around 50 to 60% of the male, they consume tobacco every day. And so that's the major reason, like it acts as a carcinogen in India. So most of the people here, also women, even they consume tobacco on daily basis. So it's common here to have buccal cancer, whereas in countries like West, they consume alcohol, they smoke a lot. So that's where geographical variance comes. So the third category is cervical cancer. The fourth one is gastric cancer. And the fifth one is lung cancer. So as you can see, over 13 lakh people in India suffer from cancers every year. It's because of the lifestyle increase in urban population, in addition to rise in obesity, tobacco, and alcohol consumption, are said to be the reasons behind the rise. The ICMR estimates that there will be a 12% rise in cancer cases in India in the next 5 years. The most common forms of cancer affecting the people of India are breast cancer, cervical cancer, and oral cancer. The number of Indians suffering from cancer is projected to increase to 29.8 million in 2025 to 26.7 million in 2021. The highest incidence last year was in the north, 2,408 patients per 1 lakh, and the northeast, 2,177 per 1 lakh, and it was higher among men. According to a report by the ICMR of the burden of cancers in India, 7 cancers accounted for more than 40% of the total disease burden: lung, breast, esophagus, mouth, stomach, liver, and cervix. And even in this cancer, again, I will say it's again geographic specific. So in states like the Northeast and in states like Rajasthan, you will see something common like lung cancer or esophageal cancer. Why? Because in Rajasthan and in states in the Northeast, they use smoke products a lot. So in states like Nagaland, in states like Manipur, you'll see more of lung cancer because half of the diet is based on smoke products. Again, these are probably the common causes of cancer. As you can see, it's all written there: tobacco, alcohol, overweight, physical inactivity, diet, environment, and a lot more. So oncologists said that increasing consumption of packaged food with harmful preservatives and junk food can be contributory factors. Earlier, tobacco and alcohol consumption were considered the most major reason for cancer. Obesity, radiation from mobile phone towers, vegetables grown in toxic water like rivers near industries, adulteration in food, artificial coloring of food and vegetables also increase the risk of cancers. The change in lifestyle from natural food to processed food, which contains certain preservatives, which also increase the risk of cancers. In mountain areas, local store food in some kind of preservatives, which suggests that the number of esophagus and stomach cancer are higher. So today we are roughly, very briefly, we'll talk about 3 or 4 types of cancer. So the first one is the breast cancer. So according to this report, the prevalence was highest in Hyderabad district, followed by Chennai, Bangalore, and Delhi. The age-adjusted incidence rates per 1 lakh women population in the above 4 states were 48.0, 42.2, 40.5, and 38.6 respectively. Out of the 28 population-based cancer registries included the report, breast cancer was the most dominant in 19. High incidence in metro cities is because of the lifestyle abuse among women who are working class, and breast cancer is a disease of urban women primarily. Then we have oral cancer. The low-income population is at the highest risk due to extensive exposure to various risk factors. Tobacco consumption has been the predominant factor causing oral cancer. The continual use of tobacco in various forms such as gutka, zarda, Khen e-cigarettes, bidi, hookah, these are all major cause of tumor development in the oral cavity in both young as well as in the adult population. Apart from the direct use of tobacco, SLT, known as smokeless tobacco, is also found to be a major reason for oral and pharyngeal cancer with a higher risk in women. Then we have lung cancer. Smoking is linked to about 90% of lung cancer deaths. And currently it's becoming more common every day because I'm pretty sure you all have seen the recent reports on Delhi, how the air pollution is, and they give certain comparative statistics that even if you don't smoke there, the air in Delhi or certain states is so toxic, it's equivalent to taking 15 to 16 cigarettes per day. So these factors contribute a lot in cancer. So as you can see, factors like inhalation of hazardous gases with substances such as cadmium, uranium, few petroleum gases, nickel, these all increase the risk of lung cancer. Rise of lung cancer in India among people who do not smoke. This can be attributed to several other factors. We recently did research on lung cancer, and it's astonishing to find that 51% of the patients, they were non-smokers. They did not smoke one cigarette in their life, but they had lung cancer. So these are commonly the reasons: smoking of hazardous gases and stuff. And then lastly, I want to brief it up by like suggesting certain methods how to reduce your chance of getting cancer. So as you can see, these are some pretty basic recommendations by oncologists all over the world. Do not smoke or use any form of tobacco. Make your home smoke free. Enjoy a healthy diet. And this thing comes to us that this we give this logic just to defend ourselves that uh, see 50% people are non-smokers, they also get cancer. So it's all based on luck. It's not that you can prevent cancer. You just have to be very preventive. You just have to care about your body. You have to have a healthy diet. Breastfeeding among mothers reduces cancer risk. Vaccinate children against hepatitis B and HPV. Also, avoid too much sun. Use your sunscreen. Reduce indoor and outdoor air pollution. Be physically active. Limit alcohol intake, and take part in organized cancer screening programs. And also take part in seminars like this that we are having. So you'll be more educated in the future. So thank you so much.
Thank you for the insightful session that you've given us. For a better understanding of the depths and concepts of cancer, please welcome our esteemed chief guest and speaker, Dr. Bharat Shankar. He is a well-reputed surgical oncologist at Vaidehi Cancer Center who has contributed to the cancer community in many ways. Please, we welcome you, sir.
A very good afternoon to everyone gathered here. Those were very indeed kind words. I doubt my presentation is going to contribute to better understanding. Perhaps it will offer an alternative understanding of what is cancer. The field of cancer is so vast and so widespread. Just like the symbol of what cancer, what is the symbol of cancer or cancerian? What do we use? Which particular thing from the animal kingdom? Crab. Why is it a crab? Because it's so widespread. It has 8 tentacles. It can grasp. Similar is the understanding and evolution of cancer. I bring greetings from Vaidehi Cancer Center, from our departmental chief, Dr. M.S. Ganesh, as well as Dr. Shashidhar and Dr. Geeta Narayan from Surgical, Medical and Radiation Oncology. That itself is testimony to the fact that cancer is no longer treated by one particular specialty, but rather a multimodal treatment. And we'd like to get that message across that there is more than one ways to treat cancer. Anyone? I think it's there on the screen itself. This is the Pulitzer Prize winner, Dr. Siddhartha Mukherjee. And he labeled this cancer very eloquently in his book, The Emperor of All Maladies. It's actually a biography on cancer. If any of you get a chance to read this or read experts from it, please go ahead. It's a very, it gives you a different perspective, like I said. My previous speaker has given us an excellent overview. I must applaud and congratulate him for doing a wonderful job. That was a really nice overview. A little bit of insight on all these things. Perhaps the word cancer came from Hippocrates, who first looked at some feeling of a particular sort of disease that is clinging onto all parts of the body. There is so much that happens with social media, digital media, access to technology. I've put up this very slide from the internet. The time when Hippocrates lived to the time when actually the microscope was invented, many, many hundreds of years apart. So when you access knowledge through internet, you need to filter out what is right, what is wrong. Never trust anything that is on the web by default. Hippocrates did not call it cancer or crab because it looked like that under the microscope, because microscope was not there in his times. So these are misnomers that we, in terms of understanding, by default develop. So keep an eye to what you pick on cancer. Why I specifically say this is because there are so many definitions of cancer, there are so many versions of cancer, there's so much that is going on in the field of research. It's difficult to pinpoint now and say what exactly causes cancer and what does not. Like we heard, 50% of non smokers don't get cancer. Does that mean that it's okay to smoke? It's a valid question. Second thing, they did a study which said consumption of coffee causes cancer, because they found in lung cancer that majority of the people who smoked also had coffee. Correct? So it's easy to, the causation and association is something again that is very important to understand in terms of cancer. So let us not just be blind. So keep an open mind. And youngsters like you, it's very important not to believe whatever older people say, because you're the ones who are going to bring a change in the future. If you by default come with a mindset that, yes, Bharat Shankar came from Vaidehi, he said these things, I'll take it back home. That's absolute nonsense. We don't want that. We want you guys to be stimulated and say, no, you're wrong. I'm going to prove that you're wrong. That is why we say we always prove a null hypothesis. We don't defend those things, right? That's how research and scientific questioning works. So this is again, I think I was told that there are a lot of students who are into stem cells, cell biology, cancer research. It's an extremely exhaustive slide. Of course, we understand that cancer is uncontrolled proliferation of cells. There is complete dysregulation in the apoptotic mechanisms. So what are all these things, these words, to just seed us, to stimulate us to read? Yes, we know that there is sustaining proliferative signaling. That means these cells must get some input to constantly divide, something that motivates them to divide. It can be a genetic factor, it can be an environmental factor, but there's something telling these cells, keep dividing, don't stop dividing. Genomic instability and mutation. This excessive growth of cells leads to an inherent damage in those DNAs, which helps it further increase in number. How to prevent immune checkpoints, how cellular energetics are destroyed, how energy consumptions are destroyed, how to recruit blood supply in order to grow, inducing angiogenesis, avoiding immune destruction, evading growth suppressor, tumor promoting inflammation, and ultimately resisting cell death. That is what is sort of a common thing in carcinogenesis. So we look at various agents, whether they can be environmental chemical agents, inherited mutations, genetic, viral agents, bacterial agents. All these things ultimately give any cancer these particular features and its ability to just metastasize and spread everywhere. And once they spread, it becomes much difficult to treat it. And hence the role of awareness, of screening, of early detection, of timely intervention. So these are what we call the hallmarks of cancer, and this forms the fundamental concepts of molecular research in oncology. Each of these facets is a branch by itself to try and find out how we can make a difference in someone's life. You have drugs that prevent angiogenesis only in cancer cells. That helps to an extent. We have immune checkpoint inhibitors. That helps. There are some screening programs for genetically predisposed individuals. That helps. So the concept of treatment and awareness and prevention is to identify each of these hallmarks of cancer and try and arrest that hallmark. So having looked at that slide, I put this up. This is a screening program perhaps for prostate cancer, perhaps for rectal cancer. The doctor is trying to do a digital rectal examination. Doctor is saying, to be completely honest, I have no idea what I am looking for. Why would that be? Because we are trying to do screening. We are hoping that patients who are asymptomatic, have no symptoms, who feel they are completely healthy, normal, we don't have a problem. And that is the population that we advise screening for. Again, this one slide is to give you that perspective of screening is for normal people. They are for people who don't have any symptoms. And that is where awareness. So each one of us here who feels is normal and has no symptoms or red signs can undergo screening for cancer if there is a family history, if there are any suspicion, or generally just for your psychological support. It's not a bad thing at all. So then I just want to highlight about a few cancer myths. Again, this is a very important part. I think some of it was covered. One, there's no cancer in my family, so I can't get cancer. They say cancer is genetic, so there is nobody in my family who has cancer, so I'm sure that I will never get cancer. It's a myth. There is Knutson's two-hit hypothesis. There is not just germline mutations, there are sporadic mutations. Mutations constantly happen. Anybody is susceptible to cancer. Cancer treatments poisonous and they are invented by pharmaceutical companies. This is there in lots of WhatsApp forwards now, that vitamin B17 prevents cancer forward, some super diet foods that prevent, antioxidants, some people who say no, this particular diet, these are all myths. There is no evidence to support these things as preventive methods. It's not true. Vaccines cause cancer. A lot of people were afraid to take the COVID-19 vaccine. It came with such fast approval. BCG vaccine took years to come, polio took years to come, DPT took years to come. Now, because there's a pandemic, they've said COVID-19 approval fast, everybody get vaccinated. It's a marketing gimmick. Why spend so much money? Vaccines cause cancer. We actually know that vaccines prevent cancer. Which are the two cancers prevented by vaccine? Excellent. HPV for cervical cancer. So that's important. And hepatocellular is what prevents by hepatitis B vaccination. These are known strategies to prevent cancer. So when does one get vaccinated for HPV? Prior to any sexual exposure. And that is important to understand that. There is no point after having given birth to 3 children to then think of prevention of cancer, because cervical cancer and pap smear screening is a big program in India with a lot of educated women. Let me really rephrase this, because sometimes I think we, the elite who sit here, we had this discussion, we assume that cancer and illiteracy is what is contributing to increasing numbers. We are mistaken. It is the educated who refuse to screen themselves. It is the educated who have more myths. Please go back home today, speak with your families, speak with your own WhatsApp groups. Find out how many of your own peers are willing to get vaccinated for HPV, how many got timely HPV vaccination, how many of mothers, aunts, grandmothers are willing to get a digital mammography for breast cancer screening. It's important to do this personal survey and you'll be surprised. All your relatives, educated, who can read, write, understand, still unwilling to undergo screening. So that is again why it's important to break these cancer myths. It can happen to anybody. Just because we know how to read and write does not mean we are protected from cancer. It can still happen to us. Knocks and traumas cause cancer. This is a very important thing. A lot of people come and tell us, as practicing clinicians, someone hit my knee. I had a small, and then we noticed actually the trauma is making us aware of a particular thing that was there. It's not what is causing the cancer. The osteosarcoma of the distal femur did not happen because of that accident, but was picked up by the accident. So the person needs to be actually thankful and grateful that they had that slip and fell, so that that osteosarcoma or soft tissue sarcoma got picked up. A grandchild kicking on the breast of a grandmother made her notice that breast lump. It's not that 3-month-old's kick on her breast which caused that 5 centimeter lump. She just became more aware of it then. These are actually common stories that you will hear. That knocks and traumas, they don't cause cancer, but it actually tells us that there might be a pre-existing cancer. Other thing, you won't lose someone with cancer. Anyone we love, despite our love, it is not as protective as Harry Potter's mother. We might love them a lot, but it's not going to prevent death if they get cancer. You can cure cancer, but it's important to remember that they can also develop cancer. Other three very important things. There is no treatment for cancer. Some people still believe that cancer is like a death sentence. Can anyone tell me what is the only absolute true death sentence in life? Let's see. Let's see. Take a vote. What do you think? AIDS, you're saying? Anybody, all of you can answer in group also. I'm not your professor. You can all pour answer. You can whisper. It's okay. No issues. Huh? Loudly? Death. Rather, can you rephrase that? That's very nicely said. Life itself, being born, is actually the surest death sentence. Because once we are born, we all have to die. But cancer is not a death sentence. I don't know if you were trying to imply that, but I gave away the answer. I couldn't carry the discussion for longer. But it's true, you philosophically thinking. That's why I said an alternative view. Cancer is not a death sentence. Cancer is very much curable. But being in denial of cancer can make you closer and faster to death. Because we again see this as clinicians, people who have visited multiple hospitals, multiple doctors, only in the hope, with multiple biopsy reviews, only with the one hope that some doctor is going to say, Illapa, this is cancer, illa. There is no cancer, don't worry. They're just hoping for that. But don't live in too much denial. It just delays treatment. Cancer is potentially curable and it is not a death sentence. Now, this particular slide, what I would like to tell you how evolution has happened with respect to cancer, how we go about managing, we try to individualize treatment. It is no longer that one size fits all. There are evidence. You can have the ESMO guidelines, European Society of Medical Oncology. You have the National Comprehensive Cancer Center guidelines. You have the ICMR guidelines. You have the Tata Memorial guidelines. We even have the Vaidehi Cancer Center guidelines. There are various guidelines. At the end of the day, we need to kind of balance it with what the patient wants to know, what the patient can afford, what the patient is likely to comply with. Compliance and feasibility in a center is very important. It's easy to prescribe and say, get the most advanced molecular immunotherapy. All of you will be reading about immune checkpoint inhibitors. Nivolumab for a single dose costs almost 2.7 lakhs. It is now recommended as the drug of choice for all solid organ malignancies until disease progression. But how many of the patients who visit my OPD can actually afford nivolumab 2.7 lakhs a month? I'm not sure if everyone in this hall can. I'm not sure if I can afford that. And at least not with Vaidehi salary. It's a joke apart. But it's important to understand what is feasibility and what is compliance. Lot of our cancer data with respect to treatment comes from Western population. That is why this particular talk that I'd like to is to stimulate all of you youngsters to come up with individual Indian data. Why is that important? The Westerners have a different physiology. Their ability to tolerate chemotherapy is different from ours. Their environmental hazards are different from ours. We live with different kind of environmental factors, social support factors, financial factors, which all play a role in this particular treatment care. So when we try to look at treatment, we have to individualize treatment. Evolution of cancer. Doctors, researchers, scientists, we are thinking that we are gaining more and more knowledge, more and more targeted therapies, more and more molecular understanding of cancer. At the same time, cancer is also evolving. Cancer is learning from itself. There was a time when we said colorectal cancers are diseases of the old. It's seen in the 60s and 70s. We have a series now at our own center where people between the age of 18 to 25, we have about 30% incidence of cancer. 30% colorectal cancers in our institute are between 18 to 25. Can I have a show of hands? How many of you in this hall are between 18 to 25? So many hands go up. Imagine if 30% of this number actually were harboring cancer. I don't mean to scare you. I just mean to highlight the reality that is now there. Cancer is evolving. It is not a disease of old age. It is there at any age. Though there are certain cancers which are likely to be seen at a particular age, no age is derived, and it's changing, it's constantly evolving. The therapies to resistance, conventional chemotherapeutic drugs that were described like methotrexate, some cancers just don't respond to these drugs. There are some genetic mutations that they have developed. We have angiogenic inhibitors, they have developed newer venues to develop angiogenesis. So these are extremely important to understand that cancer is constantly evolving. So in order to beat cancer, our research has to be one step ahead. That's the only way that we can achieve good results, or and more easily is to prevent it, like what was highlighted. And that is where I think researchers and surgeons miss that fine understanding. We're so caught up with the techniques, we forget that prevention is the key. Prevention is the key. We read about it, but how much do we act on what we read? Now, after cancer has evolved and with so much understanding of cancer, we have an MDT. That is a multidisciplinary team which tells us we have moved away from radical surgery to tailored surgery. You look at Halsted times when breast cancer used to be treated with such mutilating surgeries where entire breast, chest wall, everything was removed. Nobody wanted to get such surgeries done. Now it's tailored surgery. There is minimally invasive surgery. There's breast conserving surgery. You just remove only the target volume. Next thing, we are now starting to look at functional outcomes and patient informed and directed approaches. It's not about curing the patient or curing the disease. You don't remove the disease from the patient or patient from the disease. It's a huge dilemma, right? Sometimes patients are better off with a terminally ill cancer with just palliation, comfort, good medicines, rather than subjecting them to very toxic therapies. And that is what the MDT does. You make sure that you involve the patient. Now, why is this particular thing up on this slide? Another important myth is to not talk about cancer. We all talk about diabetes, right? We talk about smoking, we talk about alcohol, we talk about obesity, we talk about health. They're all diseases. It's very easily we'll give advice. I have received lots of advice from people saying, hey, you should do this exercise, you should do that exercise, eat this food, you'll lose weight. Because we don't associate stigma with obesity. But similarly, we should learn to talk about cancer with patients. Many people refrain from telling their dear ones that they are in terminal stages. What happens? We don't get the opinion of that individual. It is the relatives who are deciding. A lot, the patient might say, no, I don't want any of this treatment. And the relative actually becomes the second victim. The relative is constantly asking himself, what if I had a little more money? Maybe I could have done the best. Actually, the patient does not want, he wants 5 rupees paracetamol, that's all. Nothing more than that. He's saying, I'm happy, I've lived a good life. So it's important to get that functional outcomes into cancer management. Conventional chemoradiation, radiation therapy and chemotherapy has now moved to targeted therapy. We try and culture cancer cells, look at individual receptors and target them. And of course, though I'm a surgeon, we are moving to the era of organ preservation. Recently, I think you might have heard the New England Journal of Medicine. I saw some of those posters which rightly put PDL1 ligand. So they use Jemperli. It's true, without any chemotherapy, without any radiation, without any surgery, 12 patients who had rectal cancer got that particular drug and the entire tumor disappears. Nothing else given. It's a wonderful thing. Maybe we are moving to that in the future, organ preservation. So that's also something important that the MDT decides. This month, November, is actually lung cancer awareness. We've had a lot of inputs on lung cancer already, but just to highlight 2-3 things. Now, in terms of cancer survival, you look at breast, lung, and bowel. Why is it that lung cancer, we talk so much about smoking causes lung cancer, smoking causes non-smoker, passive smoking, but still the survival is extremely poor. Is it because lung cancer itself is a bad cancer, or what is it? It is because we delay seeking treatment. Lung is also the area where most of us get infections. Most smokers with infections will go to qualified, educated doctors who will prescribe them antibiotics for 1 week, 2 weeks, 3 weeks, and they come back only with very advanced stages. For months together, they have been taking 3 weekly treatments of antibiotics in order to suppress their symptoms when actually it is lung cancer. So cough, weight loss, chest pain, hemoptysis and bone pain, though rare, can happen in lung cancer. So these are all the common symptoms. Risk factors, geographic belts, they said in China. There are certain places apart from meteorological risk factors, arsenic belts in India, passive smoking in India. All these things also contribute to lung cancer. Red flags, but these are the nice guidelines. They say that any of this hemoptysis, unexplained cough, breathlessness, chest, shoulder pain, weight loss, someone's just tired and really fatigued, don't wait for the antibiotics to work. That's important. So these are the reasons why we need to get screening and look at various types of etiologies, lung consolidations, which look just like pneumonia. All these three are pictures from which I've gotten from UpToDate, which have all been diagnosed initially as pneumonia, middle lobe consolidation, lower lobe consolidation, when they actually turned out to be lung cancers on appropriate investigations. So it's important to get that chest X-ray, CT scans, sputum cytology, and a fine needle aspiration to come to a definitive diagnosis. So early diagnosis can definitely help us in preventing much morbidity. This is a very interesting picture. Anybody can recognize this man? I don't expect everyone to, but he put up a very nice statement. He said, occasionally the prince and princesses try to usurp the throne with temporary apparent victories, usually to no long term avail. They almost always fail to overcome the powerful forces of the king and the queen. What was he talking about? He was talking about breast cancers. And this was way back in 1997 when it was published, and it still holds good 25, 30 years down the lane. We have technological advances. We have natural orifice transluminal surgery. We have robotic surgery, which can offer extreme skill and technical to sort of treat any form of locally advanced cancer. But what happens? What is this? It is ultimately the cell and the tumor biology. The king is the tumor biology. So technical maneuvers which we surgeons do are all only in the prince and princess. Only often we succeed, not everywhere. Selection is the queen. That's probably my boss is the senior one. So say, yes, this patient you operate, this patient you don't operate, this you do. But ultimately, you guys are the kings because you are the researchers. And that's what I want to highlight. Research helps us understand tumor biology, and tumor biology will help us propel further treatment in cancer. That's about it. Thank you very much. Like Einstein said, it's important to have questions. I hope I have stimulated enough for you to go back and do some self reading, and happy to take any questions if you'd like to discuss. Anything? Any particular thing? You're always free to contact me. You can always call on any number.
Sir, so when we study immunology, we study inflammation as a mode of defense, like tubercular inflammation, loss of function, right? So we basically believe, or we basically know that inflammation is a highlight that our body's defense system is working against any kind of pathogens. But in case of cancer, the inflammation tends to increase the rate of cancer, increase the way the tumor grows. So how does inflammation work in cancer? Like how does it affect the growth of cancer?
It's a wonderful question. It's something that's really nice to think about. What points I'd like to add is inflammation has positive as well as negative roles. It depends on certain cancers. We need to go into the specifics. Like let's look at papillary carcinoma of the thyroid. Look at adenocarcinoma of the right colon. There are stages where the body's immune system, if on the microscope you see an inflammatory response, it actually confers good prognosis. They are in the setting of tumor cells being destroyed, preventing its local spread, preventing metastasis. On the other extreme, you have inflammatory breast cancer, which is a very aggressive variant, like you said. On the another spectrum, you have a particular intervention which was recently published by Tata, where they said injection of a local anesthetic just before surgery in the peritumoral environment modulates immunity. So certain cancers behave differently to immunity. While immunity can be protective, it can also be detrimental. It depends upon the degree of immune response and the type of immune response. Most immune responses, in a way, highlight the presence of cancer and helps us again detect cancer. However, a normal tissue with an immune inflammatory response can also mimic cancer. That is why when we look at PET-CT is a modality which we use to say this particular cancer has spread everywhere. Now that modality can not differentiate between inflamed tissue and cancer tissue. Because what is inflammation? It is cells are rapidly taking up that glucose. What is cancer? It is multiplying cells. It's taking up that glucose. The modalities that we have right now aren't able to distinguish. Doesn't mean in the future we won't have modalities that can distinguish between the two. So to answer, immunity can be a double-edged sword. It can be both protective as well as detrimental, and you need to understand which type of immunity for which cancer.
Thank you, sir. Sir, I have one more question.
Please go ahead.
Sir, recently you talked about the drug clinical trial that happened and it was published in New England Journal of Medicine. So there was complete recovery, like there were no polyps found later, and it is an excellent thing. So like we talked about geographical locations also. So do you think that if that drug comes and gets commercialized in Indian market, do you think it will have the same effect on patients in India, or would it have different effects on patients depending upon the geographical location?
So they analyzed that. In that paper, if you look at it, they did not say all rectal cancer responds to Gemperil. MSI positive only. So when they looked at microsatellite positive tumors, they looked at HMLH1, MSH2, PMS6, and these specific markers both through PCR, NGS, as well as IHC, and then categorize them as MSI positive rectal cancers. So when you're looking at genetic codes at that specific level, it doesn't really matter which geographic location you are in, because it is the molecular genetics which have ultimately culminated to forming that cancer, and you're picking it up from that person's cells. So it won't make a difference in terms of India or not. The market, how it behaves, Indian market can be very aggressive and pushy. That we all know. That is not in my hands to answer. But yes, that's something that's constant across.
Thank you so much, sir.
Of course. Shall I say thank you once again? Thank you very much. Thank you for having me here.
Thank you, sir, for the insightful perspectives you have shown us. I request Dr. Grace Joseph to present Dr. Bharat with a memento.
So thank you, sir, for the new insights and perspectives that you've shown us. Now, I'd like to call my friend Mr. Pradeep for a musical performance of the violin. So, as a tribute to the cancer survivors and the fighters out there, I'd like to recite a poem written by Becky Bishop. It's called I Did Not See You Coming. I didn't see you coming as I was told the news, my emotions all over the place. You left me shocked and confused. I didn't see you coming as you seeped within my cells, launching an attack on my body, making me feel unwell. I didn't see you coming as I lay in my hospital bed, fearing for the future, my mind full of dread. I didn't see you coming. I struggled to understand, but the nurses were always there to sit and hold my hand. I didn't see you coming as you caused me pain, undergoing rounds of treatment time and time again. I didn't see you coming as you destroyed my hair, losing all my locks, a wig I had to wear. I didn't see you coming as you made me sick and weak. Daily tasks were an effort. It was a struggle getting through each week. I didn't see you coming as you affected my family too, making them feel helpless and wondering what they could do. I didn't see you coming, you caught me unaware. Why did you pick me? It really wasn't fair. But cancer, you didn't see me coming as my body you seeped within. I'm doing my best to fight you. I'm not going to let you win. Every year, we lose loved ones to this disease, and we fight alongside them for as long as we can. Many of us fight alone, we struggle on our own. Please put your hands together and welcome Maria to share her very own cancer story.
Good afternoon, Maria. We are very grateful that you're sharing your experience with us today. Shall we begin? Yeah.
Good afternoon, everyone. Myself, Maria Jobi. I'm from Kerala and I was doing MSc Cancer Biology here.
So, can you tell us about your diagnosis and when did all this happen?
I got cancer twice in my life. At first, it was diagnosed in 2019 November when I was 19 years old and I'm doing my graduation second year. In November 21st, I was diagnosed with Hodgkin's lymphoma. At first, I found swelling in my left lymph node, and we just avoid it as a normal cyst. First, we consulted with my uncle doctor. He's my childhood doctor, and he said it's a normal lymph node swelling due to hair dandruff. So we do many things to remove that dandruff and all, we just avoid it because we never think it as cancer. So after 7 months, my grandpa was passed away due to cancer because within 1 week he just alive. After his diagnosis, he passed away. It's fourth stage and he is very old, so we can't give him treatment. After the 30th day of his death, I was diagnosed with, I got a severe fever and I was admitted in the hospital. That time we told doctor about this and normal scan was done because my blood have some variations and fever is higher and higher. So normal scan was done. There is a doubt of some infection and they referred to Amrita Hospital, Kochi, and my first biopsy was done. And in November 21st, after my grandpa's death due to cancer, I was diagnosed with Hodgkin's lymphoma. It's just initial stage and 5 months of treatment was done. After 1 year of my successful treatment, I stepped up to my normal life, stepped up to my happy life. I enjoyed a lot. And in April 2021, when I was preparing for my sixth semester examination, I just in front of the mirror and I just checked like this. I already got a cyst in my left side, so better check here too. And I found something, some swelling. Suddenly I'm shocked and I called Amma. Amma, come home. I found some swelling. When Amma came home and she also checked and she started crying because at first time the same as in the right side. So suddenly we called my oncologist and went to consult him and he examined and he told me that how you find it and he gave 10 days antibiotics whether to check it the cyst is reducing or not, but my bad luck it's not reduced, it's still persistent and my after 10 days biopsy was done, PET scan was done and it's found to carcinoma, but there were doubt that which is the origin. origin is not in the right lymph node. Actually, the origin is in nasopharynx. So the very next week, another biopsy was done because it's head and neck biopsy done as open biopsy. So sedation and all. So in May 5th, 2021, I can't forget that day because it's my parents' 25th wedding anniversary day. I pre-planned many things for them, but everything shattered, and I was diagnosed with nasopharyngeal carcinoma. And it's 9 to 10 months of treatment. Now I'm okay. It's my last treatment, my last PET scan done in January. It's been 10 months, and now I'm studying in here.
How did the diagnosis literally change your life? And it might have been very hard on your family too. So how did they overcome the?
Yeah, it was an unexpected sorrow surprise for my family because after my grandpa's death due to cancer, I was diagnosed with cancer. So, first time in my family, someone died due to cancer. So, that time for my family, cancer is equals to death. So, everyone points me like, how she's gonna face it. And I have two options. Uh, First one is be brave, or second one either die. So I choose be brave because for me, my family and their worries is more important than my pain and my life. So I don't want them to cry. I don't want them worried about me. So I decided to motivate them. I told Papa that don't worry about my life because my soul is always with me. I promise you I will not die. We have to face it together. So I motivate them. They motivate me also. They fate their worries for me. I fate my cry and worries for them. So it was a double motivation, I think we get, and it was success.
So how long were you in treatment, and what helped you keep your spirits up?
At first in Hodgkin's lymphoma, it's about 4 to 5 months. It's initial stage. I had 4 chemotherapy. It was done by 8 cycles, and second time is more hard for me than first because it's just starting third stage. So I had 33 radiations and 6 cycles of chemotherapy, and
So what about the first one? First it was detected, right? The cancer. It was which stage?
it's initial. First, it's initial, 4 months of treatment. Second, it's starting of third stage. And my spirits up, and my support and my courage was my first support was my beloved Jesus Christ and Mother Mary because without I know that I'm very much confident that without His permission, nothing will happen to me. So I'm uh, very much believe in Him, and very much my faith is very much in Him. And He is my beloved one. He is my only beloved one in this world, and He suffered in the past for me a lot. Now I accept the pain for Him. And my mother also, He cared me like a newborn baby. She never let me alone for 1 second. She's always with me. And she's my best friend too. Uh, so that's my support and my courage.
So obviously, cancer put your whole life on hold. Do you remember any specific moment from that time?
Yeah, I had many specific moments to share. I share one moment. In my second treatment time, it was the corona pathetic time. I was affected with the famous corona because it was my third chemotherapy time. Uh, and that day, it's been 2.5 months. I can't, I can't drink a drop of water because I'm that much I'm weak because everything was injected to my body as IV, proteins and all. And I lost many veins, my two hands veins, I lost every veins, and also they don't have any way to inject the proteins and all because my nasal and my mouth got many wounds, and 24 into 7 saliva and blood coming out of my mouth and nasal that day's radiation days. And that day my uncle went to doctor's cabin and asked for when should we reschedule the chemo, doctor. And he said, sir, here we are struggling to get her life back. Please pray for this night only because we'll decide and will reschedule the chemo later if needed. So that day my papa came to me because I was affected with corona. Everyone is outside, no one come inside the room, me and my amma inside the room. My papa came to me and held me by hand and told me that there is a big wall in front of you. We have to jump over it together. So that time I can't understand anything what papa is telling because I don't know I am in that much state because I can't reply, I can't respond, but I can sense everything.
You were conscious.
I was conscious, but I can't even speak. I can't open mouth due to that radiation and all. I'm in a state of always laying in the bed. And that time I am taking about 30 to 50 morphine tablets daily because my pain and palliative doctor prescribes me that because it was the time of extreme pain. That time I can't even sense pain due to extreme pain. That was the state. And the very next morning, miracle was happened. I opened my eyes and told Amma, can we go home? And doctor came. I told him the same. Doctor, can I go home? Doctor said, Maria, here we are struggling to get your life back. What you're asking, you have to stay here 2 to 3 days. We'll see. And my saturation level will be normal day by day, and I survived. Now I can still breathe. I'm still alive.
So, how is life after cancer now to you?
Life after cancer is very strange for me. Now I am adjusting every day. If someone asks me, how are you? I said, yeah, it's better than yesterday. Because every day I'm trying to retrieve the old version of me before diagnosis. But actually I can't retrieve me and I'm still waiting. Because due to that treatment, I lost many things. I got emotional and physical scars. I had many permanent scars in my body and all. And I'm waiting. I lost some. I had some vision problem, hearing problem. I had persistent chest pain, and my right side. If something happened, like some small pain arises, it is in my right side due to head and neck radiation and all. So I'm just adjusted with everything now. I'm leading a normal life, I think. I'm walking. It was a big surprise for me because I'm in front of you, everyone. I feel like it's a dream because I've never think of such a day. So I think I'm lucky and blessed. That's
Of course, you are. So, how do you feel now? And do you have any treatments you have left or any backup like treatment?
yeah. 5 years of routine follow up. I had to do 5 years of routine follow up, and every 3 months there is blood test, endoscopy, and alternate echocardio and all those done, and yearly PET scan is there. So
This year you have.
yes, this is December, my first PET scan after this
You have to
treatment.
go.
Yeah, I have to go.
So, what message would you like to convey to all of us who are present here today?
Yeah, dear all, cancer is not the end. Cancer is not equals to death. Without your permission, no one can defeat you. It's not I mean not about cancer, it's anything. Without your permission, no one can defeat you. We all have our own story. We have to write it. But the chapters should be surprising. We have to adjust. Um um, what? It's all about self-respect. If I got cancer, many of them said many things. Do like this, go there in that hospital and all. But first, listen to your heart, what your heart speaks to you, and do. We can't adjust what happens to you. We can't adjust the situation, but we can handle how we adjust that. How we handle that situation. We can adjust how we handle that situation. So, uh, try to boost your courage. It's inside you. No one can motivate you. No other one can motivate you. It's inside you. So, boost your courage. Don't choose die. Choose be brave. Okay, and it will be big success. Thank you.
Thank you, Maria. That was indeed very touching and inspiring. I'd like to request Dr. Amrinder from the ICS to present Maria with the memento.
So now we would like Dr. Amrinder to please be on stage and give us a short, not short, awareness on cancer.
Well, what can I say about cancer awareness that has already not been covered today in today's session? The only thing I would like to pick on is that awareness is very different from education. You know, like Dr. Bharat said, we are all very educated, we are all very well achieved in our fields, but when it comes to awareness, we like to put on something on our eyes and say, you know, it's like the ostrich that kind of digs a hole and says, no, this can't happen to me. Nobody's coming to hurt me. Nobody's coming to take me today. And we know, all of us know, that cancer can come to anybody. It could come to me, it could come to anybody in this hall, right? Now, what prevents people from taking action when it comes to cancer awareness, living your lives a little more mindfully? We all know the basics, the nutrition, the exercise, the food choices we make, the way we live our lives. So many LED lights and not using sunlight, you know, and various other things like you're all the time wearing footwear. At least in your homes, remove your footwear and walk bare feet. I'm not saying these things cause cancer. What I'm saying is that small things which we can do for our lifestyle to make it better, make it more natural, are today missing in our day-to-day life. When we do cancer awareness sessions, our main objective is to make everyone introspect, to make everyone think that are we missing something? You know, what is it that other nations have and we don't have? Why are we being so secretive when it comes to our illness, when it comes to some kind of a problem within me? Even failure, failure in academics, failure in jobs, being unemployed. All this becomes a big stigma. I should go hide my face somewhere. Nobody should know I'm jobless. You know, whereas failure, we all know, we have all seen it, we have all met it many times in our lives. Failure actually makes us grow. Failure is to be welcomed in our lives. And similarly, when an illness comes, I don't say you welcome it, but it's a time to go inward and check, like how Maria did, and check what is the deepest reserve within us which can pull us out of this, and share, like how Maria did. Please share, you know, if you've been sick, if you've come out of it, give courage. Make everyone aware that there are ways. Life is inherently risky. There is nothing like complete safety, complete security. But there are ways to be safer. There are ways to be more secure. Use them. Use that knowledge. Don't abandon it. It is not for somebody else. It is for us. It is for me. So that is what we are mostly trying through our various initiatives in Indian Cancer Society, to reach out to more and more people. Like it has been said, cancer is such a word that people just don't want to hear anything. As soon as you utter even our logo, when people see it, you know, sometimes that's the reaction we get, that people don't want to associate with the kind of a talk we'll have, or with the kind of a sometimes we distribute information leaflets, etc., which we didn't bring here today because you're already aware of those materials. So people don't want to take those in their hands. So there is really a huge mental block. So, you know, like how pharmacists do, they sweeten the pill. So there is a sugar coating on top, and you still, you know, swallow the pill. We also try to sweeten the deal, and we create some good events beforehand and after. So with some kind of a games, activities, something physical where the people are more involved and they feel that they are doing something more than just hearing somebody speak and take that message back home. By doing that, we ensure that people come to the hall and at least they sit through the talk and they take some message back home. And the leaflets are made in a beautiful design so that they can use it at home and they can carry it to their home, to their family members, and we invite them to be part of our volunteering event so that because when you volunteer, when you go and tell somebody, be aware this is cancer, more than others, you're becoming yourself first aware. So we welcome people to become volunteers with our organization. Come and do whatever you can. And of course, when you volunteer, it's a kind of a chain reaction. Others also get excited and they also want to do whatever it is that you are doing. So yes, we do a lot of, we welcome a lot of volunteers. We welcome a lot of we also do something called as emotional counseling for cancer patients in hospitals. So anybody who has undergone a similar journey or they are trained and they can provide counseling services free of charge because we all want to, in the end, deeply connect to another human being. That is our need. So if anybody is interested, they can contact us. They can counsel patients, but of course they would have to undergo a small training and they would have to shadow some of the earlier counselors. So volunteer with us, donate for this cause because we use the funds that we raise for basically awareness, screening, and patient support. Those are the three areas where we are concentrating. Screening, like Dr. Bharat said, is available to us, but we avoid using it. For most of us, it's up to us to take that decision and get ourselves screened. But for people who are from the slightly lesser economic backgrounds and who have less, access to, first of all, information, the correct information, even all of us with all the information make mistakes. So a person who has no information has no way of making the right decision for themselves. So no access to information, lesser access to resources, medical aid and finances. Those kind of people do need screening camps. And so we hold screening camps for them free of cost. We do it for three main cancers: breast cancer, cervical cancer, and oral cancer. So if you would like to volunteer and get involved with us, you can come to our screening camps also. And third is, of course, we do a lot of patient support. So patient support is through the emotional counseling, through the financial, when people need like a small funding to get some tests done or some part of the treatment to be funded, we do take care of that also. And of course, awareness. Awareness is a sea of activity. The more you do, the lesser it is, as the pandemic has taught us. Because we did a fantastic job of awareness for the pandemic. And if we can replicate that with the cancer areas also, it will be one big victory for all of us combined. So that's all from my side. Would you like to ask any questions related to ICS? What Indian Cancer Society does, or would you like to volunteer? Please get in touch with Dr. Shweta if you would like to. No? Okay. Thank you.
Thank you so much, Doctor. I'd like to call Dr. Suman to felicitate ma'am.
Next, we'll have a musical performance to lift our spirits by our college band.
Now, before we conclude, we'd like to have the prize distribution ceremony. I'd like to call Vishal sir to present the prizes.
Thank you, sir. Next, we call upon Dr. Kalai Selvi ma'am to please distribute the prizes. Thank you, ma'am. We call upon Dr. Estuti and Dr. Nasrina ma'am to please come on the stage. Now let's go for the winner declaration of raffle draw. We have 3 hamper set ready. Let's see who wins. Now let's go for the raffle draw for teachers. So I would call upon Dr. Veena ma'am to please come on the stage and pick one up. 32. 32. Atul sir, so please come on the stage. That's so kind of you, sir. Now we'd like to call upon Dr. Vishal to please pick a one. It's for students.
Okay, the lucky number is S10.
Next, we'll call upon who needs to pick up? Anyone from the audience? Do you want to pick up? No? Grace, ma'am, can you come and pick up one?
S37, S37.
S37. There, ma'am.
So hope you all enjoyed that. So before we go down to the walkathon that you've all heard about, I'd like to call upon Dr. Shweta for the vote of thanks.
Good evening, one and all present here. On this wonderful evening, I would like to propose the vote of thanks. It's a matter of pride for me that I got a chance to thank everyone present here in this hall. My very special thanks to the Chief Guest, Dr. Bharat Shankar, oncologist and clinical specialist from Vaidehi Cancer Center, who despite of his busy schedule has found time, gave us an inspirational speech and a lot of information about cancer. I take immense pleasure in extending my sincere thanks to the Indian Cancer Society for helping us in organizing the event, especially Ms. Amarinder Kaur ma'am, a cancer activist who is here and who has aware us about the programs we have here. I extend my heartfelt thanks to Dr. Shaji Thomas, Director SAHS, and Dr. Grace Joseph, HOD, in providing the necessary support and guidance. My heartfelt thanks to all the faculty members for their valuable support in judging the posters and the content writing events. I owe special gratitude to the non-teaching staff who worked hard to make this event a success. Last but not the least, the organizers, my students of CLMO and CBIO for successful organization and completion of the event. The event would not have been possible without them, their constant efforts and hard work. So finally, I leave you this inspiring quote by Martin Luther King. An individual has not started living until he rises above the confines of his individualistic concerns to the broader concerns of all humanity. So we all should come together and spread awareness for the great cause of cancer. Once again, I thank you all for your presence. Thank you. We will meet for the walkathon down there in the center of the campus. Thank you.
about cancer awareness, it depicts different kinds of cancer, starting from breast cancer, liver cancer, lungs cancer, colorectal cancer, and cervical cancer. Breast cancer is a cancer that is in highest rate worldwide. So women should get a digital mammography and constantly examine themselves. Cervical cancer is a preventable cancer caused by human papilloma virus. It is preventable if you take HPV vaccine. Liver cancer usually caused by hepatitis B virus. It is also preventable if you take vaccine at early age. Lungs cancer, one of the most preventable forms of cancer with lifestyle changes, stop smoking, as well as alcohol consumption. Colorectal cancer, one of the most famous kind of cancer once you cross the age of 40, but has also been reported in younger ages. People over the age of 40 are advised to take colonoscopy regularly, at least at an interval of 6 months to check for any kind of polyps or growth. Cancer is totally preventable as well as curable disease if you get screened and detected early. Thank you so much. You can beat cancer.
Kick cancer before it kicks you. Love that we need to give to those peoples who are fighting with the cancer, and we should care about them, and hope that everyone, hope is a very important word and it has a lot of meanings, and we should hope and life, fight for the life and aware. We should give awareness, and everyone should have the awareness of cancer and cure. Everything will get cured with the hope and love, care and awareness.
Fight the fight!
Fight the cure!
Fight the fight!
Find the cure!
Be aware!
Cancer cure!
Be aware!
Cancer aware!
Fight the fight!
Find the cure! Be aware!
Cancer aware!
Be aware!
Cancer aware! Be aware! Cancer aware! Fight the fight!
Find the cure!
Fight the fight!
Find the cure!
Find the cure! Find the cure!